Hello. Now we shall discuss selective eye disorders. Glaucoma is an eye disease caused by either a clogged or blocked intraocular drain, which ends with blindness due to increased intraocular pressure. The term glaucomatous cupping refers to an increase in the size of the optic nerve relative to the optic disc that occurs in glaucoma. The increase in the cup is due to loss of nerve fibers bundled in the optic nerve. This so-called cup-disc ratio is determined by comparing the diameter of the disc to that of the cup. The optic discs generally should appear symmetric between the eyes, and asymmetric cup-disc ratios should arouse suspicion of glaucoma. The larger the cup, the greater the probability of a glaucomatous optic nerve. A cup measuring 1/2 the size of the disc or larger, a cup-disc ratio of 0.5 or more, raises suspicion of glaucoma. Disc hemorrhages are also a possible sign of glaucoma. A large cup should be suspected if central pallor of the disc is prominent. Because the cup is a depressed area of the disc, retinal vessels passing over the disc are seen to bend at the edge of the cup, a useful sign in evaluating cup size. A few words about diabetes. The incidence of diabetes has increased in the modern world, which is why the family doctor should be familiar with diabetic retinopathy, which represents retinal vascular complications due to diabetes. Special attention will be paid to diabetic retinopathy cases when the patient has no complaints of vision disturbance. The explanation is that unless the changes involve the fovea directly, patients may develop severe retinopathy without any visual symptoms. Non-proliferative diabetic retinopathy. Dot and blot hemorrhages and exudates are shown scattered throughout the posterior pole. Macroaneurysms, pinpoint red dots, are difficult to see without a direct ophthalmoscope or slit lamp with high magnifying lens. Exudates in non-proliferative diabetic retinopathy. Clusters of hard yellowish exudates are prominent in the superior aspect of the macula. The exudates extend to the fovea, threatening the central vision. Cotton wool spots in non-proliferative diabetic retinopathy. Microinfarctions of the nerve fiber layer produce the lesion shown. Cotton wool spots are opaque and white, have feathery edges, and obscure the underlying blood vessels. Venous beading and telangiectasia of the retinal vascular are also shown. Proliferative diabetic retinopathy. Shown here is more advanced neovascularization of the optic nerve. These nerve vessels proliferate and extend into vitreous and spontaneously rupture, causing vision loss. This underscores the importance of routine ophthalmoscopic examination in diabetes despite the absence of visual complaints. Pan-retinal argon laser photocoagulation. Shown here are old argon laser burns in the posterior pole of a diabetic patient with proliferative retinopathy. Initially, the burns are white, but with time they develop variable pigmentation from chorioretinal scarring. Pan-retinal photocoagulation is the principal method used to prevent these neovascularizations from bleeding into the vitreous. Evidence-based research has shown that tight control not only of blood sugar, but also of blood pressure, systolic less than 140 mm Hg, and diastolic less than 80 mm Hg, shows progression of diabetic retinopathy.